In this video, I'll talk about an easy way to remember the silence classification for osteogenesis imperfecta. So, first of all, you must know that there are four types, all right? Just remember the associated words with it, and you will be able to list the features easily. So, the first one is basically the most common and the mildest. The type 2 is neonatal and lethal. This is the most severe form, all right? Then, type 3 is moderate and deforming type. Then type 4 is severe and non-lethal type. Now let's discuss about the most common and mildest. Now in this, the very characteristic feature is the blue sclera. In utero fractures, only 10%. Then kyphoscoliosis, hearing loss, easy bruising, mild to moderate bone fragility, frequency of fracture decreases after puberty, also short stature. Okay, now let's talk about the very severe form, which is the neonatal one. Now this is since it is neonatal, what we see is there is extreme bone fragility and frequency of fractures. Okay, then second, there is going to be in utero fractures almost 100%. Also 90% of the patients, they die before 4 weeks of age. Blue sclera, hearing loss can be also cannot be present. Then dentinogenesis imperfecta, small nose and trunk, and micrognathia. All right, now coming on to the moderate or the deforming type. In this, you must remember that the sclera, it can have a variable hue. Then there is going to be the frequency of fractures is mild. Also you must remember that there is going to be limb shortening. Since it's deforming type, so there is going to be progressive deformities, triangular facies with frontal bossing, and pulmonary hypertension. Then in utero fractures, almost 90%. Also no hearing loss. Now in the severe non-lethal type, again what you will see is there is going to be normal sclera, normal hearing. The fractures, they begin at infancy. Mild angulation and shortening of long bones. Bleeding thiasis is not reported yet. Now it is of two types, the A and B. In dentinogenesis imperfecta A, it is not present. In B, it is present. Similarly, I forgot to mention this subtype is also pertaining to the type 1 A and B. A basically means absence of dentinogenesis imperfecta, just for remembering sake, and B means presence. Okay, B positive, so it is present. So this completes the silence classification of dentinogenesis, osteogenesis imperfecta. I hope I made it simpler. Also, I'll just rotate the camera to make it more screenshotable for you. So, yeah, thanks for watching.